Come in.
Hello, my name is Mason. I'm Dr. Harvest. I'm going to be your nurse for today. Can you please state your name and date of birth?
Hi, Mason. My name is Berkeley Kaufman. 09/23 of 2005.
Do you have any allergies?
No allergies.
I'm checking the wristband here. Alright. How are you feeling today?
Not so good. My stomach's really hurting.
Yeah. Looks like the doctor has an NG tube ordered for you. So what that is it's a tube I'm going to run through one of your nostrils down into your stomach. And it's going to help relieve some of that pressure you're having.
Okay, because I've been having a lot of pressure in my stomach.
Yeah.
Does it hurt?
It's not going to hurt, but it may be just a little bit uncomfortable. But I've got
Okay.
some things we can do to help that.
Okay.
I'm going to give you something to drink that you can swallow as it's going down, and that's going to help it be more comfortable as well as making sure it ends up in the right place.
Okay.
Okay, I'm just getting these tapes ready. That way we can secure this on your nose. Remember, I did get it in there. Now I'm going to go ahead and measure. And actually, before I measure, can I have you cover one of your nostrils and breathe out of the opposite, and then alternate and tell me which one was easier to breathe out?
Okay. The right one.
The right one? Okay.
Yeah.
Checking in there. Okay. So I'm now gonna measure from here to your earlobe down to your xiphoid process.
Okay.
And it looks like someone's already got this one marked. However, I would mark it with tape or a marker. Have you had any surgeries on your nose, or has your nose been broken before?
Mm-mm.
Okay. I'm gonna give you this drink, so while I'm inserting this tube, you can swallow it and lick it down while you use it.
Okay.
Put this towel over you just in case anything comes up. Oh, that's good. Okay, and you already have your drink. Let me get some gloves on. I'm gonna make sure there's some lubricant on the end of this, and when it goes down easier. And I'm gonna instruct my patient to take a drink and swallow as we get this in.
Okay.
Okay, here we go.
Drink, 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 drink.
Right there to the end, and right now I don't want to let go of this because if he sneezes or anything, it could shoot up at me.
Okay.
And that would also probably hurt. We got a little piece of tape here, severed in the middle, and I want to place that over his nose and wrap it to hold this in place. I did that way too long. Keep that in place and run this up into here. Just how we measured it pretty much. Make sure this is secure over here. Okay, and the extra piece is just another piece to bridge across his nose and keep that in place. Okay. Before I do anything with suction or feeding or anything like that, or giving meds to it, you want to get an x-ray to make sure that it's in the right place. You don't want to be giving meds down in the lungs. And if it were to end up in the wrong place, you want to remove it immediately. I'm going to take this and keep this little plastic piece on there.
So I'm just going
And hook it up to suction.
take out your NG tube. Looks like your doctor has ordered your NG tube to come out.
Now this is hooked up. He's going to be on low intermittent suction. It's already on intermittent. Well, you would turn it on. You're going to turn this for 80 to 120. And it would make a noise, you would know that's on. And you would let that run. If the patient needed tube feeding, what you do is you're gonna stop suction, first and foremost, and turn all this off. Then you wanna clamp this tube here and remove it. You have to keep a hold of this plastic piece because I don't lose it. And then what you're gonna want to do is get yourself one of these. Place it in there. And before you do any tube feeding, you're gonna flush with 30 mils of water. So you do that, unclamp it, and you can raise and lower it, letting gravity go faster or slower. Clamp that again with just a little bit of water left to help out with the tube feeding. Then you're gonna put however much formula was ordered, and you're gonna let that go and follow up with another 30 mils of water, letting that go all the way down. Okay. And then afterwards, you are gonna undo this, make sure you've got it clamped, secure that back in there. The reason you're not gonna immediately put them back on suction is because it'd be pointless to feed them, it's gonna suck that right back up. So you wanna wait 30 minutes to an hour. It's basically the same thing for medications, except, well, you have to crush your medications, 30 mils before, 30 mils after. For the removal of an NG tube, what you want to do is get yourself a pair of clean gloves. First, just get them on because it's hard to get them on. But you're going to remove it. First, you want to instruct the patient, and you're coming back in. This will be a different day, so you want to check allergies over again, make sure it's the right patient. And then you're going to inform the patient of what's going on. You're going to remove the tube you guys inserted a while back and how that's going to go. So first you want to remove the tape and be gentle because obviously it's on somebody's skin. You want to get that all taken off. And then you're going to instruct the patient to take a deep breath. And you're going to remove it pretty fast. You don't want to go slow. So take that out and you're done.